Arroyo,
Is your mic on?
Doobie,
Chuby here.
Genesis,
Hennis is here.
Carver, Young,
Here.
Sanchez,
Sanchez present.
Strathman.
And I would like to ask for permission for our remote attendees this morning. Ms. Chuby, I hope you're feeling better. Jarrett,
Moves.
Sanchez, and Bill Tarver.
Arroyo moves.
Any objections? Okay. And now I'd like to ask for approval of the minutes of January 22nd, 2025.
I ask for unanimous consent to approve the minutes from last meeting.
20, January 22.
January 22, 2025.
25. Any objections? Okay, so be it. And now was that Bill that joined us?
No, it was me.
Oh, okay, thanks, John. Okay, now we'll start with public comment, and I have David Young.
David Young, well, RFK Jr. is now the Secretary of HHS. 2 years ago, I brought up his book that I left on my desk over there, but his book called The Real Anthony Fauci. Everyone should read this book. Speaking of Anthony Fauci, the Government Accountability Office issued a report in June of 2023 that found that the NIH had contributed more than $1.4 million to Chinese research institutions between 2014 and 2019. Fauci was the director of the NIH at this time. And then all of a sudden, last month or 2 months ago, Fauci was given a pardon. Not only it was a preemptive pardon. I've never heard of such a thing. Fauci was given a preemptive pardon. And ironically, that preemptive pardon goes back to 2014. And he was part of the funding of the Chinese research institutions from 2014 and 2019. I hope RFK Jr. goes back to the beginning of the COVID-19 response and the response to it, the lockdowns, the masks, forcing people to take the vaccines. I hope he takes a nice hard look at that. I am reading another book called Moving Beyond the COVID Lies by Brian Ardis. In this book, he provides a link to the FDA website of a presentation given on October 22nd, 2020. Why is this presentation important? Because the FDA was already warning of the negative side effects from the vaccines 2 months before the emergency authorization use. So October of 2020, there was a slide on this presentation given by the FDA that states safety surveillance of COVID-19 vaccines, working list of possible adverse event outcomes. And then it goes ahead and lists the adverse effects of these outcomes. Again, 2 months before it was even put into anybody's arm. It lists death, stroke, seizures, myocarditis, pericarditis, pregnancy and birth outcomes, many more, all identified by our government and the FDA 2 months before the vaccines were rolled out. Just something to think about as we go forward with with RFK Jr. We'll see how that goes. Thanks.
Okay, our next speaker is Mary Powell. Yeah, that's what I thought. Good morning, Lori. Thank you.
Hello, I'm Lori Powell. I have lived here for 22 years in Kane County. Well, last month, the Kane County Public Health Department provided a link to VAERS, which is the Vaccine Event Reporting System. That request had been made for many months. So it's great to see that information regarding adverse reactions to vaccines is finally on the county's public health website. However, informed consent is still severely lacking when it comes to vaccines. So today I'm here to make another request for a link on the immunizations page. And this would be real simple to do. It could go right below that VAERS link. Or it could even go below. So for children or parents that take their children to the doctor, there is a link on the our public health website for the State of Illinois Certificate of Child Health Exam form. So that's what is filled out whenever the kids go to see the doctor. So another very informative and I think a very necessary link to provide to all parents is that Illinois Certificate of Religious Exemption form. So parents know that if they choose not to vaccinate, that they can request an exemption, and that link can be provided right there before that health certificate form or underneath the VAERS, whichever works for the website. So that's my request, is to see that link on the website. Thank you.
Okay, that concludes our public speaking this morning. And moving right along, the reports are on file. If anybody has any questions or concerns. Okay, then moving right along. I was hoping we'd be in here longer so we don't have to go back outside in the cold, but looks like we're going to move right along this morning. So good morning, Mr. Youngstad.
Good morning, everyone. All of my reports are on file. Please let me know if you have any questions about any of my numbers. In this month, I was hoping to bring up, there's very limited information on basically anywhere right now about H5N1 and avian influenza. We've spent a couple days trying to dig through everything we could find. AVMA, ISVMA, which is Illinois State Veterinary Medical Association, the American Veterinary Medical Association, the Chicago Veterinary Medical Association, the CDC, IDPH. We tried to pull any information we could because we've received, of course, tons of calls on the avian influenza. At this time, even our local wildlife agencies aren't really taking birds. They're doing everything they can to avoid them. They're recommending we avoid them because normally the migratory birds are picked up by us and brought to them. They're telling us to stay away from them right now, just so everybody knows. Some of the basic information that's coming out is to please keep your cats indoors if you have those indoor-outdoor cats or outdoor cats right now, because the cats are outside, and one of the biggest things is they catch birds, or at least put a bell on them to alert a bird. Keep them, dogs especially, away from migratory bird areas. Avoid feeding raw milk, meat products. Watch for your new pet recalls. If you yourself find them in your yard, the CDC, and I don't want to speak to human, and I apologize, I don't want to cross the line. They're saying 5 or more birds, then to report it. And there is a number they have posted. We've posted it on our Facebook as well. That's when they want it reported, because we have people calling us with a single bird. And honestly, all they're telling you right now is wear double gloves, double bag it, and put it in your garbage can if the animal's deceased. We just are doing everything we can to bring information forward. I always want to make sure you guys are alerted. I am not claiming to be an expert on this. I do recommend that people reach out to the government agencies above us if you have questions, because like I said, the information coming down is very limited right now. I just want to make sure that everything that is out there is being brought forward and you guys have any information possible. We also know that those 5 herds that were affected in Nevada were affected with a different version of the H5N1. It was a different, I don't remember the exact numbers, and I apologize, of what their avian influenza one was, but that was a different one that they're looking into now. And again, like I said, the information coming out is very limited, but I wanted you guys to have what I had.
Does anybody have any questions for him about this situation? Yes, Mr. Young.
David Young. So the question, you kind of just answered it. We don't have any instances in Illinois or even surrounding states. This is basically found, the only area where this has been found is Nevada, which is what, 2,000 miles away from us? Is that correct?
No, it's been found
Okay.
basically in every single state so far.
Have
We just had a group out of Chicago that culled their whole farm for it. So
Oh,
it's here in
okay.
Illinois. It's everywhere.
Okay.
Illinois also has limited surveillance compared to other states. So there is a website, and it's on the CDC. If you go to their website, it will link you to everyone that has been found by state. And it breaks it down to Lincoln Park Zoo had a harbor seal and a flamingo, and I forgot the exact type of flamingo that was infected. Naperville, I believe it was Naperville. It wasn't Naperville. It was Wheaton or somewhere, just had a bald eagle test positive for avian influenza. So, I mean, it's here.
Okay.
That's why we're just trying to make sure we take those precautions at this time to do what we can.
Mr. Panasas?
Yeah, thank you for, for this report. As a dog owner, has there been any Canada geese that you're aware of that have tested positive for? this?
I have not seen any reports of it, but again,
Love.
because they're
love-
migratory is the reason everybody's getting worried right now. The thing is, if you see them dead or down, not moving, usually when a dog runs at a geese, they'll take off running. If you're noticing them not, I wouldn't let them near them right now, or you see deceased in the field, I wouldn't let them near, because one of the big things they're saying is to stop with the raw food right now. Just because there is that raw meat in there, that they worry about it not being fully cooked to kill out the virus. And that was the concern with the raw food. And that's the same thing with the cats outside running, catching the wild birds, is it's technically the raw meat, and that's how they're contracting it.
Thank you.
Okay. Okay, thank you. Go ahead. You have anything else for us this morning?
No, that's all I had. Thank you.
Okay. All right. Well, before I turn it over to Mr. Michael Isaacson, I'd like to say that February 19th is National Caretaker Day. So it seems appropriate to acknowledge that in the public health meeting. So good morning, Michael.
Good morning, everyone. Just want to provide a couple of updates and then I'll yield most of my time. I think we have a pretty exciting presentation to share some things that the team's been putting together around behavioral health. We do have a educational page about bird flu. So if folks would like more information, you can see it. We also have the link that we share out that lists every animal that's testing positive that the doctor was just suggesting that people see. So if you have questions, and I know there were cases in DuPage and all around us here, so it is certainly something that's around us. I do want to make a quick comment as well, just as we have changes at the federal government in Health and Human Services, as Commissioner Young mentioned. And there is obviously, especially after COVID, there's a lot of focus on vaccines, including well-researched, time-tested vaccines. We see right now in West Texas that there's a measles outbreak with over 58 cases, 14 people in the hospital. This is something that measles was officially declared eradicated in the United States in the year 2000 because we have effective vaccines. Since then, we have seen more people taking exemptions to childhood immunizations. And as a result of that, now diseases that we had pushed back and had pushed out of existence in our country are now returning. And diseases like measles are highly contagious. They are incredibly dangerous, especially for small children. So I am a very cynical person. I'm a big fan of asking questions. I do believe we all want what's best for our children, for our families. So I think discussion and debate and those kind of things, that's very important. And I think that's very healthy. But I do urge caution. And I can tell you as the administrator of the public health department here in Kane County, I do have concerns over the next several years. If fewer and fewer parents are getting their children immunized, we are going to see children getting sick, and we are potentially going to see children die in our community from diseases that we shouldn't even have to deal with anymore. So again, I think there's a lot of great questions and a lot of things we can look at, but especially for things like measles, that we have really proven that we can get rid of. I think it's something that is a concern of mine as a public health professional. More positively though, and I think we have some exciting things going on around our public health department, especially with behavioral health right now. So again, thank you to the board for the investment with ARPA funding to really kick up our ability to respond to behavioral health issues in Kane County. And one thing that we have launched is a website called Behavioral Health 360. This is something that is a project that's a national website that we can tailor to make specific to Kane County that provides resources to folks. So really excited, and I'll turn it over maybe to Director Peterson if she wants to do an introduction. And then we have Courtney Duran, a fantastic member of our team here, who's going to give us a little tour of this new website. So Kim.
Thanks, Michael. Yes, so I'll just reiterate, thank you for approving the ARPA funding for us. This is one of our initiatives along with funding a lot of our community partners to do direct service, kind of that reactionary piece that getting help outside, we also, one of the prongs we wanted to address was getting help for yourself, helping yourself. So this is a self-help behavioral health platform where you can log in anonymously and just look around, find things that might resonate with you, or you can establish a username and password and view as a HIPAA compliant user, save the assessments you take, save the articles and videos and strategies that resonate with you. So you can build up a profile to go back to at any time. And that includes issues like that most of us deal with once in a while, like sleep issues, diet and nutrition, exercise, everything from that up to the more severe mental health symptoms that people may face. So it's really for everyone. Courtney is our clinical manager for behavioral health, and she's been leading this project for us. And so I'm going to let her go into a little bit of a demo and let you guys ask questions. Go ahead, Courtney.
I can work all this.
Yeah, it's always surprising.
Try to do this. Can you guys hear me? Okay. I don't know how, let's see. Make this so that I don't have to sit so close. Okay, can I share my screen with you guys?
Be sure you speak loudly so we can all hear what you have to
Can you
say
get
this morning.
closer then. There we go. Okay. Oh, no, that's okay there. Oh, actually, put it here. There we go. Okay. Perfect. So everyone can see the screen. So hi, my name is Courtney Duran. I'm the clinical manager for behavioral health. I'll kind of jump in since Michael and Kim gave a little bit of a background information that I would normally give on Behavioral Health 360. But this page is what everyone is met with when they first come to the website as someone who's never visited it before. On this page, you have the option to type in specifically a Kane County zip code. So all of the different Kane County ones will pop up. I'll just choose for this purpose to opt out. It'll also ask what race you identify with. And for this purpose, I will also just opt out. Those are a couple things that we track just specifically for the county, since anyone can access this website from anywhere. Sure. Yeah, so on the website, just as somebody who doesn't have an account, you will see up at the top left, there is a toggle for English and Spanish. So the entire website is translatable from English to Spanish and vice versa. There's only one section on the website that isn't, and I will show you that in a moment. Just like Kim said, there's a few different purposes to making an account. So just like she said, getting personalized content. So as you use the website over time, it will start personalizing content to the different areas and topics and articles that you are choosing and clicking on viewing. You can also save everything from the website. So if you like a specific topic or a specific assessment you want to go back to, or different resources, you can save those. As well as tracking your results over time. So you can also take your assessments, retake them, take them over time, and then track your different results if you make an account. But of course, if you just want to visit it, peruse the website, look at Kane County resources, you can do that too without an account. You don't have to make one to enjoy the website. Up in the top right, which is also available regardless of whether you have an account, is a Need Help Now button. This gives any type of resources that you can use in the now. So it gives you resources for 988, general mental health emergency, suicide prevention information, as well as LGBTQIA support, abuse and neglect, and addiction and substance use. So these aren't county specific, they're just resources and chat lines, hotlines that you can contact if you need help for any of those. On the right side, though, is Kane County specific resources. And just FYI, we are still building this out. The Kane County resources section is kind of like a living, breathing area. So as we continue to find out about more resources within the county, we have made it pretty robust, but we are continuously working on it and adding to it. So along the right side is just some specific shelter information, crisis, and MAR now for medication assisted recovery that people can access for help right now. I'm going to move to what the website would look like if you have an account. So this is mine. So here at the top, you'll see just a few different areas. So when you have an account, you'll see some of these things have changed. It'll show me assessments I've taken, different resources I saved, things like that. It'll show you, and you have a streak going on, which is kind of exciting. So it'll say I've been using the website for 6 months, and it just came out a few weeks ago. So obviously we've put a lot of time in just reviewing it, making sure that it looks good. So I've been doing that for 6 months. And then there's a little bell that just reminds me that I have some things to finish. And when I click my name, it'll show me kind of like just a snippet of what I have going on. So I have a couple different things that I'm in progress working on, different series, some assessments that I have taken that it's saying, hey, you want to take these again? These are what you've taken. And then of course, just some favorite areas in here, a little insight into my world. And then down here, it just shows you. So on the other page, it'll show you kind of the benefits of signing up down here, these 3 areas down here. And when you have an account, it changes over to those actual things. So it shows me what I viewed, it shows me the resources that I've saved, the assessments I've taken, things like that. As you move down the page, when you sign up, it asks you to make a goal and approach. So you can choose out of these different goals of something you want to work on. And then you can also choose an approach to it. So I'll just show you if I want to manage or sleep better, like Kim said, sleeping and nutrition, things like that. It'll give me a few different options of how I want to approach that. So let's say I want to do exercise and body movement, and then it will show me specifically different tools down here, information, videos of how to sleep better, specifically relating to exercise and body movement. So you can change that over time. It asks you to do that when you sign up. But it can be changed, it's not permanent. As you move down the page, there are different resource collections. So for February, there's a few here, and they do try to tailor these to different awareness months. So these are the ones for February, and they do change every month. Down here, I'll skip these for now because there's different tabs for these, but topics, the different topics, insights, and I'll go into these more in each tab. So for topics, there's over 100 topics in here. I like to use anxiety just because it's easy, but if you see the hearts, these are where you can click to save your different topics or information that you would like to save into your saved section. So if I choose anxiety as a topic, for example, it gives you kind of a snippet of information here. And down here, it'll give you basically everything that has to do with anxiety. It'll just give you all the things, stories, articles, podcasts, videos, the whole 9 yards. You can tailor this by going to personalize. There's some quick ways to do it here. You can do it by media type. You can do it by stage of life, quick filters. If that's not enough for you, you can go to advanced. And then there's a whole section on the side to tailor down to everything, the audience, the different resource that you're looking for, and then some resources within the county are here as well. If you go to assessments, this is the section, they're called assessments, but I like to call them more of like screeners because they are non-diagnostic. So what they do is they help screen for different things. So I really like to use the Are Your Worry Days a sign of anxiety because this one only takes a minute. So if you go down to the bottom and you click view resources, it'll show you exactly what evidence-based screener it's being pulled from. So for example, people in the clinical world might know the GAD-7, it's 7 different items that screen for anxiety. And so for the purpose of this, I'll just quickly go through here because I do like to show people that at the end of these screeners, if you do have an account, you can track your results, which is neat. So at the end, it'll give you a nice little report. It'll say, based on, quickly me just going through and putting in random answers, it said that I have mild anxiety. You can email your results. So if you're somebody who doesn't have an account, you can still take the assessments, but you can email your results, you can print them, download them as a PDF and save them for later. It just won't track them in the system. And then for this purpose, it'll give me a little snippet here. And then, of course, I use this one as a little example because it's only a minute long, but it'll track my progress over time. So obviously I have the same screening result because I just choose the same answers. And then here it reminds me, take the assessment again in 14 days. So I can say, yeah, please remind me in 14 days, and we'll kind of see where my results are in 14 days and how that tracks and changes. At the bottom, there'll be some information about anxiety, different videos, articles, things like that, some county resources, because when we put the resources up in the county section, we can tag it with different types of topics. So any ones that have been tagged with anxiety will come up here in this Kane County resources section. It'll give me some other topics that we can, you can check out: anxiety, young adults, stress, and then some other screeners that and assessments that it will recommend that you check out as well. The Learning Lab is a really exciting area. I think this is just kind of fun because there's a series section. It's split up into 2 subsections. So the series is, this is really like, I like to explain it as like collections. So you'll see there's one that says audio series and then one that just says series. The audio series sounds exactly like what it is. It's like podcasts. So in here, it'll just give you media to listen to. So just podcasts, and they're all about practicing meditation for the purpose of that one. The series one, so we'll stay on the same topic, new to meditation. It's a good example because it shows this is one that I'm in progress with, and it'll show me where I'm at. So I'm 20% through, it'll show me what I've already done. You can jump around or you can do it in order. It shows you how long each one will take. So if I'm in a hurry and I want to just listen or watch this 2-minute one, I can check that one and, keep it moving throughout my day and work on this through time. So the series ones specifically give you different types of media. So video, podcast, you'll see along the side, an insights article, things like that. It'll give you different types of media. So a few different ones in here for the series section. And again, I like to explain that as more of like collections because all of the information in there is under what the topic is. So stress less, all of these different podcasts are going to be about stressing less. As well as under here, the other subtopic is practices. Now this is the area, and it'll tell you right up here, this is the only area that is English only. Credible Mind, which is who this website is powered by, they are working on getting this section into Spanish too. It's just taking some time because all this information, these are all different videos, and it's some of them are pretty long. This one is 30 minutes long. It's visual and audio. So this is a section that they're working on. But you can choose based on how you want the media. So if you want something that you can listen to, there's a couple in here that you can listen to. If you're somebody who's in an area where you don't have headphones and you're around other people and you want something to watch and read, you can check that and it'll give you the 5 that are just something to view. So these are just different practices that you can use. You can, if you're, again, dealing with anxiety and you check the anxiety, it'll give you the ones that can be really helpful to relieve anxiety symptoms. Under the Insights tab, so this area is specifically articles from people who are experts in the field and personal journeys. So as you look down here, for example, we have somebody who's a licensed psychologist. We have somebody who's an activist spiritual director. So this is just people who have written articles that, they're either people who work in this field or they themselves are somebody who has personally gone through some of the things in here that they have written about. So you can, again, filter and refine on the right side by the different topics that are here, or you can specifically type something in here. So just as an example, if I type in anxiety, it'll give me different insights regarding, or that talk about anxiety, how to cope with anxiety, things like that. And the news section is actual news. So it comes from like Psychology Today, Time, NPR, different websites down here. And it's the same information along the side. You can either filter and refine by a topic of your choice, or you can go by the chosen topics that Behavioral Health 360 has in here. The difference between insights and news is, again, news is from news websites, and when you click them, it takes you to an external website. So if I check this one, it'll ask me, you know, you're going to leave Behavioral Health 360 and go to a new website, and it'll pull it up in the website that it comes from. The insights are from within the website. So you can click on this and your article is within the platform. Lastly, and the most exciting part, because we've worked really hard on this, this section is all of Kane County resources. We've had to manually put in some of these, well, all of these actually. So there's different tabs at the top that you can choose from. We just added this anger management one. So like I said, this is still in the works, and we can continue hopefully to expand it and make it very, very robust. But somebody just requested, hey, can you put an anger management tab in there and add some resources under that? That's a really difficult area to find find resources for our clients. So if you check anger management, you know, there's not a whole bunch, but there's some different agencies within the county that can help with that. So Behavioral Health 360 is still working on making these alphabetical, or at least get an option to make them alphabetical, and working on refining them better so that you can check multiple of these and tailor down to a few specific agencies that serve all of the different filters that are on here. So the last part of this section is if somebody is on the website and they can't find a resource they're looking for, or they just need some extra help or extra support, they can click this link and it'll take them to our page where somebody can connect with Tony, who's our information referral specialist. So it'll give some information about her, phone number, email, and then they can click the link and it'll go to our form where somebody can inquire to connect with her from there as well. So we have the resources page, but also a way to connect with a person at the health department that can also help get someone connected with something that they're looking for. And then just the last area is about us, and it's some information about the health department and our website so that they can open up and get to our website, which highlights Behavioral Health 360 as well on there. So thank you. I'll open it up to questions if anyone has any.
Wow, 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 wow. That was amazing. That was a lot of information. I'm sure there must be some questions. Anybody have a question for her? John?
Of course. So thank you, Courtney. That was pretty interesting. Just some questions as you were going through that.
John, you need to speak into your.
Thank you. So how much of the content do we drive, we being the Kane County Health Department, roughly?
Yeah, as in, are you asking how much are we putting in here like this? So just like Kim said, this is powered by Credible Mind. So all the information in here is from Credible Mind and their clinical team. So they uploaded and put in the assessments, learning labs, insights, all that information. What we really tailored is the way the website and the platform looks, as well as all of the Kane County specific resources and the About Us tab. So all of that is Kane County specific. Everything else is fueled and uploaded by the Credible Mind team.
Okay. Question. I may have missed it, but I didn't see a pregnancy counseling resource like Corbella Clinic or something. They're neutral, you know, either way so it might be interesting to do that. And I looked at the organization, not that it needs to be alphabetical, but it might flow a little easier if I think I remember the name of, but maybe that might help. Let's see. Are there any surveys? Well, I'm thinking how AI could be driven into this site. So I know that's not us, but it could be the folks that run this. So as I'm cruising through resources, AI could be used to say, here's a resource you could use, or how about this? Just as an option. It doesn't make you do that, but it can be very powerful that way. And I'm sure they have the ability to add it to do that. So I think it's great. Fox Valley Hands of Hope, another board I'm on, is there. So Michael and I have talked about that. So this is pretty good stuff. I think there's, ways to continue to improve it. It's great.
This is
Thank you.
impressive.
And just, yeah, I forgot to also highlight, there is like a little search bar up here. So if you are looking for something or remember like Fox specifically, Fox Valley, we do have Fox Valley Hands of Hope in here, but if there's something you remember, but I love the idea of making it alphabetical. So hopefully we can get to that soon. But yeah, if you type something in, it'll give you a few different ones that are under that specific word.
Mr. Genesis, you had a question?
Yeah, when you first open it up, you type in your zip code. So like, how does that interact? You type it in a zip code. Does it like provide distances to services, or I just don't understand why it's by the zip code.
Yeah. Oh, go ahead. If you
Another aspect of this that's super important is us, sorry, collecting data on the back end too, de-identified, of course, and understanding that we're only serving Kane County residents. This is a platform that is available and being launched in multiple communities, but it does cost money. So we want to make sure that we're serving our community members, for one. And two, it's to run data analysis. Like in this zip code, this topic seems to be very important to people. Again, not linking it back to the person ever, but we can kind of get those insights to say, well, maybe we need more services that address this specific issue in this zip code, or maybe we need to look at what's going on in that area that's causing an uptick in this, or, anything from root cause to just like surface level interventions. So that's kind of the purpose for that.
That makes sense. Thank you so much.
Another question, how are we promoting this?
Um,
Because it's so fabulous.
yeah. Did you bring all the swag?
I do have the swag. It's in my car. I can go get it. It's in my trunk.
Would you step up to
Yes.
the microphone so people online can
Sorry,
hear
this
you
is
as well?
Hannah, our wonderful intern. So
Hi, I just stepped in working on this website with the lovely Courtney just about a month ago, but we do have promotional items. If anybody wants to come up to me, I can write down your organization, where you're at. We're happy to pack up a bag and bring you some, but we've got bracelets, which I'm wearing. We've got pens, magnets, little fidget balls, and
chapstick.
chapstick.
We have
Yes.
chapstick. We also have some flyers. So, and I can go get them. I did bring them here today so that you guys could have some. But yes, and then we also, the flyers, we have flyers that on the one side say, talk about behavioral health 360, and has like a little QR code so people can scan it. It is mobile friendly, so you can scan it from their phone, open it up on there. And then on the other side, it has Tony Garcia's information, who is our information referral specialist, the person who works at the health department that can also directly help somebody get connected with resources. So, and we're pushing obviously information out on social media and LinkedIn, Facebook, all the different platforms that way too.
If you look at the canehealth.com website, there's plenty of stuff on there. Same with our Facebook page and social media.
Good. And so, all these little blings, are you giving them to the associations, the other agencies that are listed?
Yes, so I've been going, every community meeting that we all go to, we bring all of the promotional items and offer them to folks. And if they want more to bring back to their organization or anything like that, we provide that. Also, Courtney has been doing a lot of demos, and Hannah's been shadowing and some other of our staff, so that they're going to be doing demos, just like you saw today, just a little bit slowed down. For any organization that requests. We also have open invitation demos scheduled where people can just pop in. So just follow our socials, follow the website, and Courtney will go and get the promotional items to give to you guys. And again, like Hannah said, you can just contact us and we can bring them out if you're going to an event, or it's something that you'd like to promote among your, social networks. That would be great.
So, committee members, you have an assignment here. This is fabulous. I really think this is fabulous. John, did you have another question?
Yeah, I was kind of following up on yours, Ms. Strathman. I think that's a great idea, but a link to this should be on every one of those companies' organizations
That's a good idea.
website, should be on the county website in unsuspecting places, so when you're just cruising, looking at your taxes and you're stressed out, you could see something like this.
Yeah.
But other organizations, every city, every, township, we should just be pounding this out there because I know it's not free, which kind of goes to my second question. I guess to you, Michael, knowing that this is not free, but obviously has some great value. What are the metrics that we're going to use? I'll be ridiculous and say that 5 people use this in the next year. At what point does web traffic become cost effective, and what metrics are we using to determine that?
Yeah, I think we're at the beginning of really identifying what our baseline is for something like this. And one model that I think is really critical, and thank you, Courtney, for the great presentation. Frequently in schools, we'll talk about like a pyramid model where at the top, the smallest number of people need the most acute services. So there's people in our community who may need to be hospitalized for a behavioral health issue. There are people who may need inpatient treatment for substance use. As you go down to the bottom, you get to where everybody is, and everybody needs to be doing some type of self-care. So, on one hand, and this is kind of coming back to your question, we have over 500,000 people who live in Kane County. So as we start to look and say, well, how many people should be using this website? I think we have some discernment to do on that yet, because I wouldn't say, well, 500,000 people need to use it, even though maybe 500,000 of us could benefit from it. But we're pushing this out more and more, and it just launched. So the team is just getting all of their information out now. And this is really part of our kickoff here to really make this available to people. So more on the metrics will be coming, but I don't know, Kim, you have something else?
Yeah, so we as a team are going to get together early in March to assess our first month as far as the engagement analytics. And we'll be closely monitoring the engagement analytics on the back end because we can see all of that. How long people are staying on which pages, how much usage is getting, just clicks versus actual engagement. And again, then we'll dig more in, hopefully with the help of Liz's team, after we gather months of data to see what topics are hot, what things we should spend more time on in other areas. So we'll be closely monitoring that.
And I will say, and I think Director Peterson's team's doing a good job with this, and Director Elliman as well. When we started this is really starting from scratch, where we have had some children's mental health efforts, but we haven't been funded to do other behavioral health things. So as we were talking about the investment in this, it really is building the plane as we're flying it. So this data collection is not just through the website, but it is also with every initiative that we're doing around behavioral health. So Courtney has mentioned that Tony on our team is working with a lot of people in the community. We're collecting data on all of that so we can see what's happening. We have provided direct funding to many organizations in the community. We're collecting data from all of those organizations. So really, data collection is a really important part of this, and the website's just really one input.
And have we asked Julie Mann to cover this? And
Yeah.
okay, good. Good.
I think the press release, yes, there was a press release about it maybe like 2 weeks ago. And we're continuing to promote it throughout. And then also the communications campaign that we're just starting, it will include a lot of promotion of this platform in the different things that it offers.
Great.
Mhm.
Any other questions? Yes, Mr.
Yeah,
Panas.
so yeah, that's the key right now is the communications plan, making sure people are aware of the site. I don't know, is this mostly grant funded that this is being done through? And is there any way, reaching the people, making them aware of that, people who are in need, digital advertising, people that are doing web searches, is there any way that we could do maybe some digital advertising? Because that can really focus on the people and getting them aware and getting them the need, the help that they need.
Absolutely.
Absolutely. Thanks for that. We are entering in we already have the communications campaign with the company we're using, and this will be a huge part of it. A lot of it will be digital. And then again, just our grassroots effort that we normally do every day is just going out there hustling, going to every organization we partner with, talking to them about it, showing them how it works, and talking through it with them about what the benefits to their clients, parishioners, students, whoever is there with them, how they could maximize the use of this platform. And then again, always monitoring the engagement. If we see a dip in engagement, we know maybe we need to up our efforts or stream them in a different area.
Thank you.
Any other questions or comments?
Madam
Oh,
Chairman Allen?
John, did you have another question?
Good. I think Deb has something.
I'm sorry. Oh, Miss Allen, you had a question or a comment?
Thank you, Madam Chairman. I just wanted to say this is pretty magnificent. And I was wondering if there would be a committee of the whole or something where we could do 15, 20 minutes on this. Every one of us is connected to neighborhood groups and agencies in our districts. And I think I can't wait to share this with some of my neighbors. So I'm just suggesting that the whole board get a chance to see this. And thanks so much, guys, for working so hard.
I think that's a very good idea. Thank you for that.
We would love to do that.
Yeah,
Thank you.
this is really, really good. So, and I would also love it if you would keep us apprised of, what you're learning as you build it and let us know how it's going because, wow, this is very impressive. Thank you for sharing this with us. So,
Thank
John?
you so much.
So much.
One quick thing. ARPA is a 4-letter word. And it's good because it helped start this. My concern is it's gone. So how are we going to support this, which I think is a great idea, could do great now that money's not around.
Yeah, no, excellent. And ARPA is a catalyst for all of the work we're doing around behavioral health. So it's an initial investment, and then that's something that we're working on an ongoing basis. For a lot of these things, the initial startup cost is the heavier lift, building this all out, but there will be ongoing costs. So we're constantly looking at other grants and other ways that we can fund these things.
And I think
Great question.
again, the power of the data, of the engagement data to show the return on investment. As we get to that point where we need to look for immediate sustainability, we can show what the ROI is and what the benefit to the community is to secure those funds going forward.
thank you. Thank you. Thank you. Wow. How do you
But
top
it's,
that?
this really is just a snippet of what's going on. So I think as we talk about these things, it's all really different pieces that fit together as a whole approach. Director Onwuda reminded me that I should have mentioned, switching gears a little bit here, for environmental health. We're not incredibly satisfied with we're quite dissatisfied with the platform that our team uses to go out and do restaurant inspections. It's very inefficient. We use a tremendous amount of paper in 2025. Some of the things that we had hoped the platform would do, I don't know, 10 years ago or whenever we switched over to it, have not materialized. So we are working with the development department, and we are putting out a bid to identify a new vendor that is hopefully going to be much more efficient and save us a lot of time and money. Our environmental health area is one where we have a higher amount of turnover. And I think part of it is we just it's the grind of inefficiency with this platform that we currently have. So we're looking for tremendous cost savings switching over, and that'll go out next week. Is that what we're targeting? So working with the purchasing department and the development department, because these are parcel-based things. So we try to coordinate across departments as much as possible for like nuisance complaints and things like that as well. So I don't know anything else that I should say or that you want to add, Director Onwuda.
No, thank you, Michael. I think you said it all. It's really important for us to get a system that is more efficient, in terms of time, because the one we have right now, we can't even use when we go out to do inspections out in the field because of some kind of firewall. It's behind the firewall. You can't use it. It's a mess. And every time I talk about the old system, it's almost like my staff start hyperventilating. So looking forward to a better system that hopefully will be SaaS-based and easier to work with. It costs us a lot of money just to make updates on this new one. So things that should be easily updated. So that's what we're looking forward to.
So thank you for keeping your finger on that pulse. I know that has been a problem for the health department for a while, that area. So thank you for coming up with some solutions for that. So, okay, you have some more for us this morning.
So we do have a resolution.
Go ahead and,
Okay, so this first one is just kind of the pro forma that is going through every committee, authorizing procurement cards issued to Kane County Health Department, including transaction limits.
so I need a motion and a second.
Motion, I'll make the motion for that.
David.
Pennis
Johnson
is second.
seconds, and Ted Pennis is seconds. Okay, thank you. Now, this is just business as usual, right?
Yes, we
So-
have one card. It's in the name of our CFO.
Any questions, comments? Okay, would you call the roll?
Arroyo, Doobie,
Juby, I.
Genesis,
Genesis, yes.
Tarver,
Carver, yes.
Young,
Yes.
Sanchez,
Sanchez, yes.
Strathman.
Yes. Okay, motion passes. Okay, and then
We have an additional resolution authorization to enter an agreement with Winnebago County for medical services. This was distributed hard copy here in the meeting, and then I did email it to the members who are online.
so I'd like a motion and a second, and then we can discuss.
I
Anybody?
make motion.
Ted Pennis. Okay, Pennis and Royal. Okay,
So just a little bit of background on this. We have had a ongoing relationship.
you were handed out.
Yes, everybody should have a copy. With Advocate Healthcare to provide medical services. So we contract for the services of a physician. This is something that's critical for us, both for standing orders for our vaccine clinics and any medical services that we provide. And potentially most important is for the control and treatment of tuberculosis here in the community. We were notified in December that Advocate was going to be eliminating their local infectious disease program. So that ended our long-term contract with them. I mean, we go out to bid every few years and things like that, but that ended our agreement with them at the end of January. We did work with the purchasing department and put out a request for qualifications with the hope that we would have no gap in service for this. Unfortunately, we did not receive valid applications that we were able to just pick up and run with. So we are now entering a period where we do have a gap. I have reached out to my colleagues in the area at other health departments, because this is pretty specific when we're talking about treating tuberculosis. And Winnebago County Health Department has agreed to pick up and help us for a short period of time here for 6 months, so that we have time to put out a request for qualifications and do a little deeper search. I do have some concerns longer term about the financial side of this, because we've had a really great deal with Advocate for all of these years. So this may be a cost. But for right now, this is a budgeted item that we have. We budget $24,000 a year for this. We expect over this 6-month period that we're probably going to spend less than $5,000 on this intergovernmental agreement. I was asked, because I'm just bringing it in, I will go ahead and read it into the record. Authorizing agreement with Winnebago County for medical services. Whereas the Kane County Health Department is an Illinois state certified and nationally accredited health department responsible for the control of communicable diseases and for enforcing rules and regulations to protect the health of the public. That Illinois Code 2305 is referenced. Whereas the Kane County Health Department requires the services of a medical director to provide written orders for clinical services and to assure proper screening and medical follow-up of patients with tuberculosis. And whereas the provider that has provided medical services discontinued their local infectious disease program, ending the contractual relationship with the Kane County Health Department. And whereas the Kane County Health Department developed and released a request for qualifications for medical services through the Kane County Purchasing Department, but did not identify acceptable applicants. And whereas Kane County Health Department requests a short-term 6-month intergovernmental agreement with another local health department to assure provision of services continues to allow time to re-release a request for qualifications to identify a long-term solution. And whereas the Winnebago County Board of Health has voted to provide said services to Kane County for a 6-month period, whereas these services are included in Kane County Health Department's approved 2025 budget. Now therefore let it be resolved that the Kane County Board authorizes the Executive Director of the Kane County Health Department to sign and enter into an intergovernmental agreement with the Winnebago County Health Department for professional medical services for a period of 6 months.
Okay, thank you for reading that. Do we have any comments or questions?
How much was the contract with?
Mr. Pennis is speaking.
Yes, sorry.
It's $2,000 a month. So
Anybody else?
You're expecting that to probably go up when we go out. to
I
bid.
worry it does.
Yeah.
It's been a pretty good deal.
Okay, any other committee members? Okay, John?
It's a real quick one. Is there a resolution number for this?
Do we
I
have-
just see 25 dash blank.
Stephen Ford, the State Attorney's Office. I think what happened here was because this was walked in, it hadn't been put in Legistar yet, which would generate the TMP number. So that's something we can work with the Health Department on when it gets put into Legistar for exec, if this passes.
Okay. Any other comments or questions? Okay. So please call the roll.
Arroyo. Doobie.
Doobie, aye.
Genesis,
Genesis, yes.
Tarver,
Tarver, yes.
Young,
Yes.
Sanchez,
Sanchez, yes.
Straffen.
Yes. Okay, passes.
Yeah.
Okay.
And I do want to just publicly acknowledge my colleague, Dr. Sandy Martell, who's the director of the Winnebago County Health Department, and their medical team for being willing to help us in this situation. We're very appreciative.
And Winnebago is Rockford?
Correct.
Okay. Okay, thank you for them. Okay, any old business this morning? Yes, David Young?
Hi, David Young. I just thought for the new members of the committee, I would like to point out under the Kane County Standing Committee, it's on the website. It talks about I'm going to read what this committee is supposed to do per the Kane County statute. This committee shall have jurisdiction over all matters concerning the county board's function as the Board of Health established pursuant to applicable statutes and any other county ordinances related to the Board of Health and to all matters relating to county noxious weed control. This committee shall also have jurisdiction over the Office of the Animal Control Administrator, which will include the purchase of supplies and equipment for said offices. So, as far as when it comes to the Public Health Committee, I mean, obviously, we're here and our biggest commitment, I think, to the taxpayers is to make sure that the Kane County Health Department functions in a efficient way. And then we're also here to watch their budget as well. So I just wanted to bring that up, everybody, so that, the new members. And sometimes you think about that too, is why are we here as a committee talking to animal control and the Public Health Department. So just wanted to put that in everyone's mind.
Okay, thank you. Any questions about that?
It's me again, sorry. Did I hear you say noxious weed?
Yes, it is in the statute. Yes, sir.
I believe that's
Okay.
legal now.
Those kinds of weeds.
Thank you for that input, Mr. Sanchez.
Well, he would know, right?
It's interesting to me, Madam Chair, because we were just talking about solar panels around the county and how there are noxious weeds under pretty much every single one of them. So now we know who to call to go weed whacking.
Yes, Mr. Isaacs.
I just want to make a comment and invite board members, any issues that you see in your community, please let us know. Last month, Mr. Young brought up the important issue of texting and driving. So we did add some additional information to our website and did put out some social media information about that. It is a really critical issue. But if any of you are seeing anything in your community that resonates with your constituents, we do comprehensive community health assessments. We're always looking to see what's going on. But nothing is more important than what you're hearing from people and what people are actually living in the community. So please pass anything that you see along to us, because as Mr. Young had mentioned, this that's the role of this committee, and we report to the board. So look forward to any input and thoughts you have.
Thank you. Okay, do we have any new business? David Young.
Hi, David Young. I think, I know that when animal control comes in, and a lot of times they'll list, hey, this is the number of cats and dogs that we had to euthanize or that we did vaccinations for. I think it would be interesting for us as a committee to see, based upon some of the major programs that the health department has, how many people were serviced by the health department for a particular program, like the behavioral health program, for example. Or we just passed this resolution for the these vaccines that we want to work with Winnebago on. How many people did we vaccinate? I'd like to have that information going forward so that we can just say, hey, this is what the public health department is doing for the community. And it doesn't have to be an encyclopedia, but maybe the top 5 things that were done that previous month.
And your thought is that should be on the website? Is that what you're thinking?
Or just be a report, like the
just
animal
the
control. I mean,
report. Okay,
there was no
I see.
report, but every time there's a report, and then these are the number of cats and dogs that we had vaccinated, rabies tags, whatever. I
So
mean,
you want to know when a person bites a dog? That's what I'm.
they deserve it, but I think it'd be interesting because it would have to be just, hey, these are the number of people that we're reaching, and then we can have a conversation going forward. Okay, well, why are you like behavioral health? Well, only 10 people were reached last month. Well, why is that? How do you reach more people? That it could be that kind of a discussion, because we have this public health department, it's being funded and it's being underutilized. That's the main reason for bringing this information out. So that I was just thinking about that could be some kind of a report, if you want to even call it such a thing, going forward.
And that's definitely something we'll provide more data at ongoing meetings with the breadth of programming that we do. And there's some additional complexity with the variety of funding sources that we have. But this being able to share actionable information with you is one of our top priorities. So absolutely, we will provide more data next month. And as you mentioned, we can kind of make an iterative process where maybe you say, can we hear a little more about this? And maybe I don't need to see all that. Or perhaps we include a couple slides that the data's there if you want to see it, but maybe we don't have to spend as much time on it each month. But yes, excellent comment. Thank you.
Thank you.
Okay. And Mr. Young said.
Good morning, everyone. Welcome back. One of the things I wanted to discuss is a possible resolution I'd like to bring forward next month, and that's to get King County a DEA license. Actually, we're one of the last counties in the state of Illinois that don't have this. Chicago.
What is that?
Department, what is it? DEA is for controlled substances. I'm trying to think of what their exact acronyms for. But it's for controlled substances. Right now, when you have someone licensed like our veterinarian is looking to leave us in around June, give or take. We haven't received her letter yet, but we know it's coming. When a veterinarian leaves, they have to leave with all their controlled substance. This just happened in city of Chicago. It just happened in the city of Aurora. The 2 facilities are scrambling to get their DEA license back up and running now. I would rather King County not wait till we're in that moment of going, oh, gee, wildlife cannot be euthanized or picking up. What we can do is we can apply to have a DEA license. The county would then be licensed with the DEA to only control 2 and below. I'm not talking about level 1. There's no need for that here. And this would only be for our controlled drugs for euthanasia and chemical immobilization. Those are the two things we're responsible for. And what this resolution will do, one is authorize the county to move forward with that, but also appoint someone as power of attorney to complete those forms on behalf of the county. At this moment, I would put myself forward on the resolution. The county can change that at any time. But the beauty of doing it this way is, say I get hit by a meteor or bus tomorrow, you guys can come together, formulate another power of attorney, and continue moving forward with operations like nothing ever happened. The downside, if we don't do it that way, let's say our veterinarian gets hit by a meteor tonight, technically every drug she brought for this facility or this county must be put aside and disposed of with the DEA. So all this is doing is I'm trying to get continual operation for the county to ensure there's never a loss of service for what we're trying to do. And if there's any questions, concerns, please bring them to me. I would love to discuss them.
Any questions?
I'm assuming most animal
This is
control.
Mr. Pennis speaking.
Pennis, sorry. I'm assuming, I know, right? I'm a newbie. I can still get away with it.
No, you can't.
But I'm assuming most county animal control agencies have that licensing already.
Yes, most counties do it this way. We're actually one of the last ones
gonna
to
say, I
move in
was
this direction. And seeing what just happened in city of Chicago, what's happening in Aurora, we don't want to take that chance knowing our veterinarian's about to lose us. But before I did it, I wanted to make sure I spoke to this committee to see if there was any questions or concerns before I brought forward a resolution, so everybody fully understood it.
Well, thank you.
Being proactive, always a good thing.
Brian.
Yeah, me. Just one quick thing, going back to Mr. Young's comment for both of you. One thing I've been asking the committee, I'm not on this committee, but I ask people when they present, because very often we'll get, here's, reports are on file next, which is understandable. But what I think Mr. Young is looking for, which I think is helpful, is like, here are the thumbs up. There's 5 things. Here are the thumbs up in the health department. Here are the thumbs up in the veterinary area. Here's the thumbs, here's things we're worried about, because this year is going to be a tough year for this board. And so the more you can say, we're fine with this, what you just said was a prime example of this. It's a thumbs down right now. We need this DEA certification, help us get this through. But these things are good. Website's good. Website's so-so, or here's what we're doing to those kinds of things. Just boom, 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 boom. They can be in the report, but when you highlight them, then people who may be asleep, hopefully nobody.
And I would like to say that I think that's a little bit of that is the work of the committee members.
Yep, absolutely.
Coming prepared to the meeting I don't think we need to be spoon fed. I think there's a little bit of responsibility on the part of the committee members to do that. So just a little, my own personal opinion there. So, but thank you for the suggestions. And do we have any questions about this for Mr. Young said this morning? I think being proactive is a really good idea. We don't want to get caught with this situation. So, okay, so we'll be looking forward to that resolution then next month.
Thank you.
Okay, good. And can I have a motion to have the reports placed on file?
I make a motion to, for unanimous consent to place the reports on file.
Okay, thank you. Okay. I
Pennis.
guess we'll get him trained yet, won't we? Okay, and now I need a motion for an adjournment. Aurora moves
Second.
and Mr. Young seconds. All in favor? Thank you for a very, very informative